Welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and today I'm going to be talking to you about Alzheimer's care and swallowing problems. And today's episode is focused on the basics. So the first point is, what is a swallowing problem? And basically the medical term for this is dysphagia. And some people can have trouble swallowing food or liquids or both, but some signs of dysphagia are choking or coughing, if you're bringing food back up, or a sensation that food is getting stuck in your chest, or someone that's always drooling. And typically that's because if you try to swallow your saliva, that would be something that would cause you to end up coughing and sputtering. So if you have dysphagia or any type of swallowing problem, some of the complications for that are you could become malnourished, you could become dehydrated, or you may end up with an aspiration pneumonia. And in Alzheimer's disease, typically around 85% of people at the end of life are going to experience some sort of swallowing problem. And so that's why we're talking about this today and how to manage the swallowing problem as the person moves through the disease process. So second point is, kind of who has swallowing problems and why. So about 9 million Americans suffer from swallowing problems every year. 1 in 5 of those are older adults, and typically about 40% of people that live in a nursing home or an assisted living facility may have a swallowing problem. So causes for that could be related to like you've had a stroke, there's been a head injury, Parkinson's, or advancing Alzheimer's disease. Sometimes if people have had mouth or throat cancer, that's going to cause a swallowing problem. People with severe gastroesophageal reflux disorder or GERD. And then other things could just be related to trouble chewing and swallowing. So if you've lost most of your teeth, or you have problems with moving your mouth and being able to swallow. And it causes a lot of problems for people just because you might be afraid that you're going to start choking in front of other people. You may have a lot of fear or anxiety attached to it. The people that you live with that prepare your meals, they may have a lot of anxiety about what can they feed you that won't end up choking you. And from a medical perspective, we don't really have a comprehensive guidelines for how to help people manage dysphagia. So this 4-part series is meant to kind of give you the basics, and then we're going to talk about adaptive equipment. We'll talk about modified textures, and then in the 4th part, we'll talk about how to maximize eating independence. So the third point is kind of learning the lingo about when you need to adapt food or fluids to manage a swallowing problem. So we'll first talk about diet consistencies. So if you are eating now and you don't have a swallowing problem, that's called a regular diet. And some of those foods will be soft, and some of those foods might even be pureed. So if you think about applesauce, we typically think of that as something that someone who needed a pureed diet would eat, but you don't have to have a swallowing problem to eat applesauce. So the next level down is mechanical soft. And these foods just require less chewing. So it would be like taking a hamburger patty and cutting it up so that there's less chewing. You're not going to have to bite it and chew it in order to swallow it. And to do mechanical soft, there may be different textures or thicknesses. So you may end up chopping, grounding something, or pureeing it, depending on what needs to happen. So my mom refers to this as kind of like soft foods because my grandmother doesn't have any teeth. And so they're always having to think through like, what are the best foods for us to eat for both generations, for people who don't have a swallowing problem and people that do. And then the third level of diet consistencies is the pureed diet. And when I say the term pureed, it doesn't necessarily have to mean, liquidized. This could be like you mince the food item, or you puree it and it's still thickened, or you may need to liquidize it. So it just depends on if the person's having trouble with swallowing thin liquids. We'll talk about liquids in just a second. But typically, if it's a pureed item, it doesn't require any chewing. So this is like pudding, mashed potatoes, applesauce, and you can put And we're going to talk about how to build flavors, but you could take a regular food item and put it into a blender and in order to make it pureed, but we still need to be able to make sure that it's flavorful. And so we'll talk about ways to do that in, I think, part 2. And also things that are already liquids, so broth, milk, juice, water, any of those things could be added to a food item in order to make it easier to swallow, because sometimes, if the food's too dry, that can get stuck compared to just adding a little bit of liquid to it. And speaking of liquids, there are 4 different liquid consistencies. So you think of pudding thick, which is like an extremely thick, like you could put a spoon into that liquid and it's not going to move. Honey thick is kind of more moderate. Nectar thick is only mildly thick. And then you have thin liquids. So thin liquids is basically like just a regular cup of water. And there are products to help. If you have a thin liquid that you need to thicken, there are commercial products that you can use in order to do that. But that's kind of the lingo. 3 different diets: regular, mechanical, soft, pureed. And for liquids, pudding, honey, nectar, and thin liquids. For any of the liquid consistencies, you probably need to work with a speech and language pathologist in order to help you determine exactly how much thickening you need to do to the liquid. So that is the end of part 1. Be sure you join me for part 2, where we're going to talk about how to modify textures and do that flavor building that I mentioned. Part 3, we're going to talk about different adaptive equipment that can help with swallowing. And in part 4, we'll talk about maximizing eating independence. So I hope to see you again, either back in this podcast platform or back on YouTube. And thanks for tuning in.
Thank you for tuning in to This is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and if you'd like to learn more, you can check out my other episodes on my YouTube channel by subscribing and ringing the bell to get immediate notifications when new content comes out. In addition, you can also find the audio version of the podcast on Amazon Music, Spotify, iTunes, and Stitcher. Please feel free to leave an honest review, because more reviews mean more awareness of the podcast and helps us move towards an age-friendly world. If you have a comment or a question, you can visit my website, MelissaBPhD.com. Go to the Contact Melissa tab, and you can leave me a voice message. You never know, I might just include your question or your comment in an upcoming episode.